Eastern medicine is so different from Western medicine. And when you combine the two together, it's called complementary medicine.
Right.
And,
or integrative is another term that they use.
right, yeah. And one thing that I always want to stress to people is if you've got a doctor, Western medicine doctor, that's important. That's what you have to have. But there's nothing wrong with complementing that treatment with Eastern style medicine. As a matter of fact, you're much more, it's much more effective. I found my own personal experience.
I couldn't agree more with you. I couldn't agree more with you. I think that's, you really see that nowadays. That's really where our healthcare system is going. Everything has its strong points. You know, acupuncture has its strong points, herbal medicine has its strong points, but so does Western medicine and the pharmacology in Western medicine as well.
And the World Health Organization recognizes that.
Yeah, absolutely, absolutely. There's a huge list of different disorders and issues and diseases, whatever term you want to use, excuse me, that the World Health Organization has seen fit to call acupuncture an effective treatment for.
Cool. And can you tell us like what some of those are?
Oh, absolutely, absolutely.
What do you find acupuncture to be particularly good to help?
Well, all right, particularly good.
Are those, they may be two very different questions.
Not really,
No? Okay.
not really, not really. Again, every different modality or technique that you use for treatment has its strong points. But really in this country, what people are most familiar with is using acupuncture for pain. Pain relief. Works fantastic for working on different sorts of pain relief. We're talking, you know, migraine headaches, cluster headaches. We're talking issues like lower back pain, sciatica, neck pain, tennis elbow, frozen shoulder, all sorts of sports injuries. It does a fantastic job. I think as we get into it a little bit and I explain kind of what, from the Chinese medical point of view, what acupuncture is working with, what it's doing, you'll see why the list of these different conditions on the World Health Organization is, you will see that they involve almost every system of the body. That it's actually an effective treatment for all sorts of reproductive issues, dysmenorrhea, amenorrhea, infertility, impotence. It works with really well with a lot of gastroenterological issues, gastritis, IBS, gastritis, constipation, diarrhea, all sorts of issues like that, nausea, a lot of nausea as well. It actually helps with eye issues as well. Treatment for conjunctivitis. One type of cataracts actually has seen a good response with acupuncture as well.
Oh, really?
Yeah. And what does it do for the cataract? Does it get rid of it?
It helps reduce it. Again,
Wow.
cure is never a word you're going to hear
Okay.
me use. I think what's key with any sort of medical treatment is to looking as a progression. Am I better off today than I was 2 days ago? Are we moving in a positive direction? You know.
Now, I'm interested in the cataract because I've got little ones. Not the right kind of little ones.
Well,
I've
I
got
do too.
little cataracts.
Yeah.
Right.
Yeah.
There's a very specific type, and we can talk about that, I guess, a little later.
Yeah.
That it works with. But another aspect of what acupuncture has been shown to be good for is are psycho-emotional issues. In Chinese medicine, the idea that what's going on with our psychological, emotional, is not separate from our physical issues. It's they all have a reciprocal relationship. I mean, just a simple example, when you're in a lot of pain, you're emotionally not the same person. I know every human being is more irritable, right? Is very sensitive to anything.
And depressed.
And depressed,
Yeah.
right? And they go hand in hand. And again, like I said, it's not a one-way street, right? So when we have these psychological issues, Chinese medicine recognizes that it'll have a physical manifestation as well. So I'm really happy to see the kind of changes going on in our medical system. I think we're catching a wave now of integration. You know, the school I went to has a clinic that works out of Governor's Hospital in New York that provides acupuncture for post-surgery patients. I know of at least one gastroenterologist in Connecticut that employs an acupuncturist on staff to help with various gastrological issues like IBS, like gastroparesis, where your digestive system stops working, basically slows down. You see it in a lot of, particularly auricular acupuncture, you see it in a lot of rehabilitation and recovery. There's actually something called NADA, the National Acupuncturist Detoxification Association. that actually started in a hospital in the Bronx. A 5-point protocol for helping addicts recover and calming down. So it's
I was going to ask you about addiction. Is
yeah,
it-
yeah, absolutely, absolutely. It's definitely helps. It
Nada?
definitely helps. Yep. And so it's more and more. It's becoming accepted more and more. I even there are places that service terminal cancer patients and use acupuncture and palliative care for that as well. So it's becoming more and more accepted, and to me that's the future. And why not take the best of what we have and the best of what other cultures have come up with and put it together? Because going forward, we're all human beings, so why not do the best that we can? Again, more tools in the tool belt. It's never a bad situation.